On today's podcast, we're going to be talking about falls. So, as we're getting older, there is an increased risk of falls, and around 1 in 3 adults over the age of 65 and half of people over the age of 80 will have at least one fall a year, significantly impacting on well-being. On today's podcast, we're going to be looking at staying steady. So looking at things we can do to reduce the risk of falls, whether at home or in residential care. So one of the major risks for individuals as we're getting older is an increased risk of falls. And falls obviously contribute to a significant impact in well-being, mobility, and that's sort of long-term health effects. My gran had a major kind of change in her well-being after a fall. She lost all confidence for one, but also some incidents occurred, which meant she ended up being hospitalized for a significant period of time. And unfortunately, I think that significantly contributed to her deterioration as far as her dementia is concerned. I thought I'd cover a little bit of information. Years ago, I worked with an organization called the Falls Prevention Society, and we did quite a lot of work together. And also one of the courses that we deliver is falls prevention and looking at reduced risk. And there's some simple things that we might be worth, whether in your own home or whether it be looking at a residential home, that we can do to decrease the risk of falls. It is one of the leading causes of injury among older adults, but there is things we can do. So let's go through a few aspects. We'll start off understanding the risks though. So why are we more likely to fall as we get older? Well, unfortunately, there is some natural aging effects that increase the risks. One is reduced muscle strength, potential balance issues as the hairs in our ears become a little bit more damaged, obviously not the ones on the outside, the ones on the inside, become a little bit less sensitive, so balance can be affected. Vision problems can contribute to it as well. And also, obviously, we're on certain medications or more medications. You've got issues with blood pressure, and certain medications can definitely increase dizziness or potential drowsiness as well, increase the risk of falls. There's also, as we talk about a lot within sort of elderly or adult mental health, there is a risk of certain dementias as well. And one particular dementia, Lewy bodies dementia, one of the early signs of Lewy bodies dementia is an increased risk of falls. Okay, they fall at a greater rate. We've also got other things like Parkinson's and things like that that can all affect mobility. So there is a few factors that increase the likelihood, but there's also environmental hazards as well. So yes, as we get older, there is an increased risk of falls. We are a little bit more unsteady on our feet, potentially. Not all as a generalization, of course. But obviously the environment can have a big impact. So one of the things that we can do, when I worked with the Fall Prevention Society, there was a number of things that they would put in place. So you could, I don't know whether it's still around or still going, but you could apply for funding and they would come in and they potentially do things to help a person stay in their own home. One of the things, obviously, reducing clutter within the home, sort of minimizing potential trip hazards, and also looking at any cords or mats or anything like that may be starting to get a little bit older, a little bit frayed, starting to curl at the edges. These are all things that could obviously increase the risk. We've also got, so there is things we could do, kind of either secure rugs and carpets, or you can get the ones that are more tapered, so less likely to kind of curl up at the edges. Whenever we're looking at anything like risks, the same as we would in a workplace, even if we're in our own home, we can still kind of follow the hierarchy of controls. So the first thing is we eliminate. Does it need to be there? Can I get rid of it? Then we'd substitute. Well, can I replace it with something else that maybe is a little bit more applicable or a little bit more, a little bit safer? If we can't do that, then it may be going into kind of isolation or segregation. Well, can I move that trip hazard off to the side? Could it be in a lower traffic area? Still keep it in the house, but maybe it doesn't need to be where it currently is. So those are preventative elements we can do just on kind of general clutter around the house. We could also obviously, quite a lot of places, introduce things like handrails and grab bars. And obviously it is highly recommended, like handrails on stairways significantly reduce the risk of falls. So if you don't have them in the house, then definitely getting those fitted. Obviously, most workplaces have to have them as mandatory as far as their health and safety assessment is concerned. But we can also increase things like grab rails in areas that are more risky, like the bathroom where we might have a slippery floor. We can make sure, or where we're balancing because we're doing turning and moving and things like that, then we could be grab rails in there. They don't have to look clinical. That's one of the things I think sometimes people worry about. There is various styles out there that you can make it kind of fitting within their own home. Just been doing some work with a family recently, actually, who are wanting to keep their mum at home, and they feel their bathroom, although lovely, is quite high risk. It's quite hard edges and things like that, and they're currently looking at things to kind of try and reduce the risk to a lower level. And one of the aspects they're looking at is grab rails to try and make sure that their mum has some things to hang on to when she's kind of moving around the bathroom a little bit, just to reduce that risk. One of the major causes of falls. So I know my dad is terrible for this. He likes to keep his slippers way past their best before date. That's probably the most diplomatic way of putting it. So he will wear them down to, I don't really know what they're left. It looked like I don't know, what's the equivalent of a kind of a slipper that's now in thong state, where there's very little on the slipper itself. It's kind of being held together by just basic elements of seams and fabric. And he sticks with it because apparently it's comfortable. But obviously there's more likelihood for the foot to slip, for rolling the ankle. Probably the grip on the slipper isn't very good anymore. He has a habit of rubbing his feet together as well. So he's probably worn the grip on the shoes down to nothing. So poor footwear can be a contributing factor. Or another one, as we heard, was like clothing, kind of tripping over clothing as well. So trying to make sure we're getting, good quality slippers and ones that fit properly and replaced appropriately, as long as they're willing, can all be factors that kind of reduce that risk as well. Now, one of the other ones that's worth considering, and we don't always kind of consider, is actually lighting. So one of the things is like at night and things like that, when the stairway's a bit dark, people sometimes, if they're tired, a little bit drowsy, they end up taking a wrong turn, and rather than turning into their bedroom, they accidentally turn into the stairwell. And although when we're younger, we maybe laugh at ourselves, but we don't bounce as well the older we get. So there is that significantly increased risk. So is there things we can do as far as things like night lights may need to be introduced so that the stairs can be visible so the person isn't moving around in the dark in the same way? But there is other things we can do as well. So lighting generally, because one of the things can be a risk is bulbs going. If I'm unable to climb up on steps and change bulbs, if a bulb goes, I might end up going to bed and that bulb not working on the landing. So one of the things that they instigated within the Falls Prevention Society is they started doing kind of a routine and scheduled kind of bulb changes rather than waiting for the bulb to go. We'd kind of then base it on the kind of the average and get the bulb gone before that happened. And obviously, that was in a time a little while ago, so it was before kind of the LED lights came into play. So obviously, they do have a much longer shelf life, and therefore they'll probably last for a little bit longer. But again, what happens if one goes in the middle of the night? So having an idea of how long they typically last and systematically changing them to reduce the likelihood of falls, or having backup systems, with a torches or something like that around, can obviously reduce the risk as well. Okay, so there's a few bits as far as things that we can do within the home. And the one thing I'd sort of say is the more we're trying to encourage people to stay in their own homes, these little adaptations, little adjustments, they are much better to do preventatively rather than waiting till the first fall occurs. Because obviously you can get the systems and the automated systems that call through to a support service when a person falls. So the buttons that people wear, so when they go down, somebody contacts us, check they're okay, or they can press a button if they fall down. But even then, there's still the fall. And there's a risk factor as far as getting somebody straight up, especially with conditions like dementia, for instance. Individual dementia can't always recognize pain in a typical way. So they may say they're fine, but actually they've damaged themselves quite severely. They just can't communicate it, or their brain doesn't recognize the injury in the same way. So actually, always we're looking for prevention rather than cure, because you've got to wait for an ambulance to turn up to check whether a person's okay. That isn't always ideal if they're going to be like 3 hours. A person sitting on the floor for 3 hours in one place is really bad for them as far as circulation and further issues and pressure problems and things like that. So Prevention better than cure when it comes to your own home. Don't wait for things to go wrong. For those of you working residential, so there is things we can do as well, just actually adding on to that. If we're looking at prevention rather than cure, promoting good exercise, promoting standing up and getting things for themselves is really important to reduce the risk of falls. One of the things that happens in many residential settings is sometimes the mobility of individuals deteriorates quite rapidly when they move into the residential setting. One of the reasons for that is because when they were living in their own home, they had to get themselves a glass of water. They had to get to the toilet themselves. But when they move into residential, suddenly people are there to help them. And sometimes we kind of take that independence away from them. In fact, I've seen it many times where individuals have been positively dissuaded from moving around, getting up and kind of walking. Sometimes it's because people are worried about them falling. What I try and get over is the less we let them stand, the more likely they are to fall. Those muscles are only going to get weaker. They're going to become more dependent on aids to be able to then get up. So we should promote mobility, making sure obviously risk assessed and positive risk assessment by walking, some things like Tai Chi and gentle yoga and some great exercise groups out there that will help people stay mobile, stay active, and still keep utilizing those muscles to help them to stand and to balance. It still, again, is a skill that can be practiced to not lose completely. So when we're looking at reducing the risk of falls in residential care homes, I'll tell you a story, actually. I was actually teaching moving and handling training at a particular setting. And we were just going off to look at slide sheets and how you use slide sheets in a bedroom. And on the way there, I noticed a hazard that none of the other staff did. And I raised this as a kind of, I spotted something on the way that I don't think is good practice. And they hadn't noticed. And all it was is somebody had put some laundry to dry on some of the handrails just outside the laundry room, which I saw on the way past. Now, I can completely get that the staff aren't going to notice that because they don't use the handrails. But the people who do use the handrails are the ones who need them. And if I was walking along using the handrail for support and, I saw a pair of knickers drying on the side, I may not want to touch those knickers, and therefore I may let go of the handrail to move around them to then re-grab the handrail, meaning you've just increased the risk of falls. So best practice specifies that there should be nothing hung over handrails, but I see it all the time, or people just using it to store stuff on. So one of the things you can always do to check within your residential home, or if you're visiting a loved one, if you spot things that are left on handrails, obviously raise that with the staff, or if you are a member of staff, then move it. The other things we could do, regularly assessing the individuals themselves. What is their risk factors? Is their mobility changing or deteriorating? Is there medication or any other conditions kind of affecting? And we're always looking to do, obviously, positive-centered, but person-centered risk assessments and personalized care plans to, again, reduce any specific risks. And part of that might be kind of assessing clothing and things like that. Is there mobility? Is their clothing allowing good movement? Is it comfortable? Are they tripping over their clothing in any way? We had a lady recently on the podcast who described with the safety monitoring that actually discovered that it was a lady whose nightie was a bit too long and she kept tripping over it. And that's why she'd had a few falls as a result of her clothing. So anything we can do there to reduce the risk of the clothing risk, but also safe environment, making sure that areas are clean. So one of the things when I'm teaching things like health and safety within care homes, things like hoovering or vacuuming, the general rule of thumb is we should always plug into the closest socket when we're vacuuming. I know that's not what we do at home. At home, what we tend to do is find that one plug that we feel we can reach the whole house from. And it almost becomes a game or a challenge, like something in Crystal Maze, where can I do the whole house without moving that plug? And I go from room to room. And sometimes I'll be overstretching the hose on the vacuum just to get into that corner because I still don't want to lose by unplugging it. And what you do at home is your prerogative, but at work, we should be plugging into the closest socket. And if we can't do that, there's other things we might be able to do to reduce the risk. So, for instance, making sure that cleaning is done at low traffic times when people are moving around less, making sure we're putting some potential signage up, indicating that there may be wires and there may be trip hazards, or definitely things, obviously, most people are aware of the wet floor signs. The one thing I say with the wet floor signs, though, is they are only a precaution. They're not a prevention. A wet floor sign doesn't stop somebody from slipping on the floor. It purely raises their awareness that the floor might be slippy. So we may put the sign there as a temporary measure while we're getting the mop to kind of get it dry as we possibly can. Or if we know it's going to dry fairly quickly, then that may just be a temporary measure. But we don't rely on them if we've got a leak. One of those is not going to have, I've met my duty as far as health and safety is concerned. The other one is staff training, as we kind of said, making sure they are using the signage, making sure they are doing the cleaning at appropriate times, making sure. One of my major bugbears that I have when walking around residential homes is things like wheelchairs, or a big one is the hoist, the mobile hoist, for those of you who are aware what one of those is. There's only 2 times that the brakes should ever be on a hoist, and that is when it's parked and when we are lifting or moving a person on a slope. They're the only 2 times the brakes should ever be used on a hoist, really. And I sometimes do come across it where I'm walking down a corridor and a hoist has been left in the corridor, and when I go over, the brakes aren't on it. And it's one of those things that if I'm unsteady, I might reach out to grab that sturdy looking thing to support my weight. And obviously, if it's on wheels, it moves, you just increase the risk of falls. So again, if you're working in residential settings, please make sure that you lock that hoist off. As far as what we should do if falls occur. So generally in residential, and this is an area of controversy, and I think it's something that people should have more awareness on, or better plans. Within a nursing home, usually a nurse will be called to come and check over the person to make sure they don't have any injuries. Because as I said, sometimes people will not know they're injured. One pain will supersede others, or sometimes their brain, due to dementia, won't necessarily recognize that they're injured. Therefore, somebody should come along and check their wellness. Otherwise, most places have it as kind of rule of thumb that you should then call the emergency services to get checked over, and then the paramedics can get them up. The only danger with that, and we have to kind of look at the risk of versus risk of not, that if somebody is left on the floor for 3 hours, that can actually cause significant problems of sort of pooling of blood, pressure sore issues. Actually can exacerbate problems, osteo. I think that's the right word. Musculoskeletal issues as a result of being sitting on the floor. So there's a lot that needs to be considered. So people tend to go, well, we'll just leave them there until the emergency services come. But if that's 3 hours later, that really isn't necessarily in the best interest of the individual. It all depends on whether we've seen them fall, risk of falls, any injuries, any kind of behavioral differences, and knowing how to properly assess a person if they have had if they are in pain, if they are injured, even if they do have dementia, is a really useful skill. We do deliver courses in pain and management in dementia care to help and teach staff to better recognize the pain responses with somebody who may not be able to verbalize or communicate that they have or are experiencing pain. We're looking for behavioral differences, certain facial expressions, certain specific actions that a person might do that actually indicate that they are injured in some way. But we should definitely, one, stay calm. Nobody feels better if they fall with people panicking around them. But assess the situation, balance and dynamic risk assessment, but see if they can get themselves up. And there's a few different methods out there. One is just obviously helping them get a chair and they can climb themselves up. There is a 2-chair method where you get one chair in front of them to kind of climb themselves up on, and then you have a chair ready behind them so they can push backwards and just slide their bum onto the actual chair itself. So there is things we can do to help them get up. There are some amazing bits of kit out there as well, as far as different equipment to help a person get up off the floor. The razor chairs are very interesting as far as you build them underneath a person and they sit a person up. But you've also got the emergency lifting cushions and obviously the hoist as well for some people for getting them off the floor, as long as it's suitable and safe for purpose. One of the things I will refer to, obviously, the safety monitoring that I covered on a different episode with Jane Connery, is one way of kind of looking at when we are getting falls, what can we do to kind of prevent those, or how can we stop that from happening in the first place? Okay. So I've gone through a fair few bits. We're looking at reducing the risk of falls. I think when we're looking at the reducing risk of falls, we have to kind of look at it from the three elements of morally, we don't want anybody to be falling and hurting themselves and reducing their quality of life, limiting their mobility, potentially causing a deterioration in their well-being because of mobility issues or hospitalization or things like that can all cause an impact. So one is the moral reasons. One is the legal reasons that health and safety law states that we should be making sure that people in our environment are safe. And therefore, if people are falling due to a lack of appropriate risk assessments, that can lead an organization open for legal prosecution. Obviously, that may not apply to individuals in their own home, but it's definitely for residential settings. The last one is financial. So financial is a huge one because it's one of those uninsurable costs. The time it takes for staff to be investigating an incident, staying with the person while we're waiting for the paramedics to stand up, the emotional distress that it potentially causes some individuals and some staff, as far as this individual or this client resident becoming injured and having to be hospitalized, all are huge impact factors on the organization that aren't necessarily seen by the accountant as far as the profit loss and the cash balance and things like that. They're kind of uncovered costs. They're just time impacts, their moral impacts, their staff retention issue impacts that actually really do affect an organization over a period of time. So for those three reasons, moral, legal, and financial, I think all of us should take risk reduction of falls quite seriously and see what we can do, whether it be on our own home, within our settings as well, for anybody listening in various settings, but also in residential homes as well. And something everybody can keep their eye out for. Okay. Obviously, if you found the information I've gone through interesting, I'll try and make sure we post a link to some additional resources and additional information, and especially some of the different equipment out there and some of the devices for protecting a person if they do fall. We'll try and link some ideas in. But otherwise, like, comment, and share. And obviously visit us on the ablehub.uk, where you can get further information. There's definitely links on there. And there's also things like the 2-chair method will be available to view in a course. We've got moving and handling courses and falls prevention, I believe, as a course on the ablehub.uk. Okay, thank you.